All right. Good afternoon, everybody. I'm James Bisco, the Senior Area Manager for Clean Slate. Thank you very much for coming. I see some familiar faces and some not familiar faces, so thank you for coming and learning a little bit about what we do here. So Clean Slate is a national medical group that provides physician-led, office-based treatment for individuals suffering from opioid and alcohol use disorders. We were founded in 2009 in response to the growing opioid epidemic. Clean Slate has grown to become an industry leader in high-quality, evidence-based care, providing an integrated care model including medication-assisted treatment and behavioral health therapies to those suffering from the chronic disease of addiction. Clean Slate's large footprint of centers is growing rapidly to meet the demand for medical services in states struggling with the opioid crisis throughout the country. To learn more, you can visit our website. All right, meet our Belchertown team. So everyone knows who I am now. Michelle Italian is right over here. She's our Vice President of Operations. Emily Dean is our Center Manager on the ground every day. Caitlin DeBois is our Community Relations Liaison. Dr. Tom Hewitt, right here, is our Center Medical Director. Abigail Cody, over there, she is our Physician Assistant in the office. Alyssa Dos Santos, who just goes by Alyssa up here, right there, is our Medical Assistant. And Jessica Labonte is our Medical Receptionist. So they are the ones who are here every day doing the good work. And what is that good work? The services we provide here are every patient has their own individualized treatment plan. We use FDA-approved medications to treat opioid use disorder and alcohol use disorder. So we do Suboxone, Sublocade, and Vivitrol. No methadone here. We provide care coordination services, behavioral health counseling, hepatitis C testing and treatment. And the goal of all this is to ease withdrawal symptoms, reduce cravings, and reduce the pleasure associated with substance use.
So the treatment goal is based on individualization of where the patient is and what they need. But usually within the first 30 days of treatment, we try to get people engaged with their program so that they are comfortable being here and that they establish a rapport with the whole team in the building. That they feel that, and that patients feel that if they tell us that they've been using something, we're not about to chop their head off and throw them out the door. You don't discharge someone from a treatment program because they have the illness that you're treating in the first place. That makes no sense. So getting people to feel okay with that idea and that they can actually do that is it can be a piece of work. Sometimes it takes time. Sometimes people just sort of get into it. They could. And this is also, as it says, the greatest time of struggle and return to use. The concept of ambivalence about just the whole idea. Do I really want to be here? Do I really want to give up my drugs? Do they really like me? Or am I really saying it's time to go? And so that this facility here is a safe place for people to be and that their needs are met and respected. So treatment is a long-term project. It's not a quick, put a Band-Aid on it and everything's fine. So for the short term of just getting people started, the idea is we get them to just make a choice. They're going to take Suboxone or not. And so they've made that choice when they made the phone call, when they walked through the door. And so the idea is they are dosed with an appropriate dose of medication. It has them feeling well, has them not being in any withdrawal. And so they'll be able to stay away from all the opiates. As they mature with the program, the idea is that they continue to move forward and now get rid of basically everything. So this is not just a Suboxone dispensary where we hand you Suboxone and maybe you don't use opiates. It's a comprehensive overview of polysubstance use because none of them are going to work out to be a good idea down the road. It's a little easier with opiates because we've got a medication that beautifully targets those. Our medication efforts for substances such as cocaine are sketchy. There isn't an ideal cocaine medical program at this point, but we work at it. And so as people enter our program, we have an entity called the Clean Slate Matrix, which is geared to tailor the intensity of our treatment to how much we are deeply concerned about the patient's stability. And as patients enter the program, our first effort with them is to get them stabilized, started on medication, and feeling comfortable. And moving forward, the idea is that the longer they stay with the program, the less substances they will be ingesting, and the less we will need to be concerned about it. And then, as a corollary to that is, the less often we'll be needing to see them. So as they start with the program, we see folks about once a week to get them stabilized. Typically that period takes about 2 months. And by that time, they're taking their medication properly, and they're letting it work, and they have given up all the opiates. And moving forward, if it turns out they're also not using any other substance, then we can start talking about coming in every 2 weeks. And as time goes by and they're not using drugs and they're keeping their appointments, and I'd like to see them also hooked up with our behavioral health people. Then as a period of about 6 months of treatment goes by, we can be talking about coming in once a month, which makes their life a lot more comfortable and a lot more easy. So that's the transition from the stabilization phase of treatment to their long-term maintenance. And so they're then on a stable dose of medication, taking it on a regular basis like we talk about, and staying away from the substances. The hepatitis C component is one that's become extremely important because there's a very high incidence of hepatitis C in our clientele. And by having them engaged with a program such as this, they're de facto sort of a captive audience. They're already coming here once a week or every 2 weeks. And so we're already working with them. They're comfortable with the people who are here. And the idea is, okay, maybe we can get to work on this hepatitis C thing. And the revolution that's come in the recent years of the treatment for hepatitis C has made this a much easier and much more comfortable thing to do. And the Clean Slate organization has really done a very good job of getting people treated for hepatitis C with a greater than 90% cure rate. And to say Hep C treatment, we're seeing a greater than 90% cure rate. I think it's probably more like greater than 95%. It's very unusual now to see someone on this treatment that did not cure their Hep C. And treating it through our office is basically, we're their buddies, we're their friends, we're their support system here, and they work well with it. It's convenient, they're already here, and the other advantage is there's a decreased chance of returning to use of the illicit substances that got them the Hep C in the first place. And so, plus I find that when people are looking to get Hep C treatment done out in the community, it can take months and months and months of showing up and having this test done and having that test done, and then we'll make another appointment, and then the thing can drag out for months to 6 months or more before someone actually gets their first tablet of medication to work on the Hep C thing. Well, we seem to be able to do this in a much more efficient and streamlined way, which has been a big help. Selection of Hep C people, they have chronic Hep C virus present, and they're engaging with their program, so they've been staying opiate free for a couple of months. Mental health stability is critical, and that they're going to plan on being here because it takes a few months of treatment to complete the course of therapy. So we want someone who's not planning on moving to South Carolina in 6 weeks. that they're going to be staying with us for enough time to complete the treatment.
So I'm supposed to be up here today with my supervisor, Emily, but she's out sick today, so you're stuck with me. I'm Stacy. I'm one of the clinical supervisors in Massachusetts Behavioral Health team. So I'm going to talk to you a little bit about what our department does in close conjunction with our medical team. Okay, so all of our counselors are licensed master's level clinicians. We provide individual, group, couples, and family counseling. We address substance use disorder triggers, trauma, and the other psychosocial and environmental factors that often co-occur with substance use disorder. We also provide counseling from the dual diagnosis perspective. So, as most people are aware, usually depression, anxiety, other co-occurring mental health disorders go along with substance use disorder. So we address those factors as well. All of the treatment modalities that we use are evidence-based. So some of those examples might be cognitive behavioral therapy, family therapy techniques, motivational interviewing, we do a lot of that, process-oriented psychotherapy, solution-focused therapy, brief intervention, and trauma-informed care. So part of what we do from the get-go is complete a comprehensive biopsychosocial assessment, and from that we formulate a treatment plan. So everyone gets an individualized treatment plan from a behavioral health department, and we tailor that in conjunction with their medical needs as well. And then we also do a lot of connecting patients with other services that they might need. So often when folks come into our offices, they have sort of some basic needs that aren't being met as well, right? So housing issues, insurance problems, nowadays issues with rent. So we'll make referrals. We also do have care coordinators that can help with that as well, which I guess I'm going to talk a little bit about too. So one thing I wanted to say also that's not on the slides is Dr. Hewitt had mentioned the medical models treatment matrix, and behavioral health just recently created its own treatment matrix as well. So it's tailored to coincide closely with the medical model, but really the frequency of visits is determined by the clinician's initial assessment, and sort of depending upon what their level of need is in terms of the severity of their substance use disorder, co-occurring mental health conditions, and some of those other psychosocial issues, we sort of determine how frequently they should be seen by mental health. I keep on waiting for someone to change the slide. Okay, so in our patient counseling sessions, we're basically assisting with patients with identifying their goals, helping them to achieve them, which is the primary focus of all of our counselors. Our services help patients to overcome the challenges they're experiencing in their substance use disorder and mental health that affect their everyday life and recovery. And then our licensed counselors can also address any substance use disorders as well as mental health conditions, including depression, anxiety, what I mentioned earlier, bipolar, grief. We actually now offer an in-person grief group out of our New Bedford office, which is nice. The groups that we offered had to sort of scale back a little bit when COVID hit, but we're really rolling those back out onto the table now, which has been great. And we all come with a wide variety of backgrounds and areas of expertise. And again, everything's evidence-based treatment approaches. Let's see here. So, about group counseling, we're running a few center-specific and statewide group sessions. So we have trauma group counseling, the grief and loss group. One of our staff members is currently getting certified in SMART recovery, which is great. That's very much like a cognitive behavioral therapy-based group modality that you can apply to anything and everything. Excuse me. So health psychology for addiction, relaxation and anxiety management. And then I actually run a statewide group for women who are currently pregnant or postpartum, having delivered, sort of a wide range. I have some women who have had their babies like 8 months ago, but I like to give them that space because it's a unique group of women who are on MAT in recovery, and they don't have a lot of other support, So benefits of our integrated approach to care. So we're seeing an increased length of stay in terms of staying on with Clean Slate services, a decrease in their substance use, improvements in communication and interpersonal skills. There's greater self-acceptance and self-esteem, big changes in some of those self-defeating behaviors, and an increase in personal and family goals, and relief from anxiety and other mental health issues. And I think Dr. Hewitt alluded to this earlier too, but creating more connections with the community, right? A lot of these folks come in here and don't have any supports in their life, and then Clean Slate really becomes like their safety zone. Care coordination. So Jose's not here today. So I'm gonna go ahead and tell you guys about our care coordination program. So I mentioned earlier, a lot of our folks come into our office and they have sort of those basic needs that aren't met yet. And how are you supposed to work on your recovery when you're worried about the roof over your head or, insurance covering your medications? And so we can make referrals to our care coordinators. They assist patients in identifying the non-treatment needs that can serve as barriers to their recovery. We aid in emergency situations that the patients face, such as loss of insurance, domestic violence and assault situations, homelessness, and eviction. They'll also partner with our medical providers to assess individual needs and better maintain the patient's recovery. And they're considered the bridge to the community and local resources in the face of Clean Slate centers. So our care coordinators are forming and maintaining community partnerships, which will allow for warm handoffs and better access to care for patients. Ultimately, better success in the Clean Slate program.
Anybody?
Thank you.